Kodas Castle from DRC came to South Africa in 2006 following unrest in his home country. He was one of the activists who marched against President Kabila's regime. This led to Kodas and some Congolese activists to be harassed by the security service of that country. Kodas entered South Africa legally and applied to stay in the country as an asylum seeker. This is when he started having problems with documentation. Carlo reflects.
From Kinshasa, I came to Lubumbashi. Lubumbashi is the city of inside of Congo. So from Lubumbashi, I took a truck and came in South Africa. I had the passport and visa, came in legally. Then I went to Home Affairs in February or January, if I'm not mistaken, to Home Affairs. So from there, I applied for the asylum seeker since 2006, January. What? Yeah, after 2 months, when I went to extend my paper, and they gave me a paper saying that I'm rejected. So from there, I wrote a letter just to like an appeal. So after that, it was in February or March 2006, they started giving me an extension. They started extending my paper.
For the next 4 years, Carlo's papers kept being extended and his appeal date postponed. Carlo was finally invited to the appeals hearing by the appeals board late last year. He went with his wife and daughter and was surprised when he got arrested upon arrival.
And in 2010, I went for the appeal hearing. So last year, November, I was surprised being arrested, right? Because they just told me I'm not legal, I'm not no longer stay. I don't have to stay anymore in South Africa. So we were surprised because we thought we were coming to get extend our paper. So unfortunately, my wife was really crying because they couldn't put her into the van. Because she was carrying baby, and unfortunately, because she was crying, that affected also the baby started also to cry. And the immigration guy, they told me, no, yeah, you have to be. They gave me another 1 month to come to be extended. So when we came another month, after a couple of months, we are coming to be extended. And surprisingly, in March, we are getting arrested. Fortunately, when the event wasn't there. Reason why they released us and they told us to come tomorrow. And by tomorrow when we came, we are really arrested. Fortunately, the guy who's supposed to decide for us to go to Lindela wasn't there. Reason why they left us. And the supervisor of Home Affairs told us, you are really lucky because you should be at the right time. At this time, you should be arrested and going to Lindela.
Carlo has a wife, a 2-year-old daughter, and his wife is pregnant with their second-born. Carlo's wife is 7 months pregnant and can't access health care in the country because she is scared that she might be deported back to DRC or she might run into trouble with the officials.
I'm scared. I'm still scared because I don't know what can happen to me at any time. Maybe they will arrest me when you go to deliver. You have to bring your clinic card from where you are attending your appointment, and you have to have your paper like ID or something, or if people Asylum, something like that. You have to have it. If you don't have, they won't allow you inside. Maybe you can have your clinic card. They will allow you to deliver there. But once you have delivered, you can't get out with it. They won't discharge you. They say maybe you are a thief or something because the security are there for checking. You have always to carry your paper and your clinic. It's affecting me because I'm not too far for my delivery, so maybe in 1 or 2 months I have to deliver. So I don't know what am I going to do. So it's sometimes I've got pains, but I can't go to the hospital because in the clinic they say they just take care of our appointment for checking, something like that. But when you have pain, you have to go to the hospital. But from now I can't go. If I've got pain, I just stay at home and take my Panado or something like that.
Adiakbo Olwafemi is a researcher for Africa Center of Migration in Braamfontein. He highlights some of the challenges faced by asylum seekers in South Africa with regards to healthcare and other basic needs. Adiakbo says based on their research, he has discovered that most of his case studies, like Carlo's wife, are usually ill-treated in hospital, and that makes it even more difficult for them to seek medical attention.
I understand that situation. From the previous research, we discovered that these people, they are being discriminated against, and they thought, these health workers workers, they talk at times a lot of negative words to these people, call them names. At times when you see someone like that in such a situation, like just the person that has 2 months to deliver, you understand, on queue, they might, what they do at times, they even ask them to go back to the back of the queue and give some South Africans a kind of prevention treatment. They do it as well. Even they will say that this one, I'm a query. They call you name. At times they don't give them quality healthcare because they believe they are straining the South African system. Like when you don't want people, you have to like force them out in so many ways, you understand? Yeah. And meanwhile, the Constitution and the acts, National Health Act, support these people in this case that you have to give them maximum treatment. They should have access to healthcare, whether they are documented.
Carlos' wife is due to give birth in less than 2 months. She has not received any medical attention during the pregnancy and is afraid to give birth in a public hospital. I am Ngobeni reporting for Law Focus.